Okay, so he is a case of 12-year-old boy, known case of hemophilia. Okay, so this is the classical presentation. This is the classical presentation of how his hemarthrosis of the knee presents to you in the OPD room. Okay, so he has all the classical findings of how hemarthrosis presents. Okay, so he has an acute onset of this swelling since 2 days. So there is sudden onset of swelling. At the same time, he keeps the knee in flexion attitude. He is unable to extend. He keeps the knee in flexion attitude. As you can see, on extension and on range of motion, it is painful. Okay. Second, unable to bear weight. And fourth, most importantly, there is local rise of temperature, severe swelling, acute onset, along with that painful range of motion. Okay, so how do you manage this case? First thing, no aspiration, no arthrotomy. First thing is you replace the factors. Okay, then you give rest, ice application, you give compression bandage, and you give elevation, that are classical rise therapy, factor replacement, and gradual physiotherapy. Along with that, proper monitoring. If there is any suspicion of infection, you definitely have to evaluate further with USG and MRI, SOS if need. His X-ray shows the classical hemophilic finding, widened intercondylar notch. Along with that, on the lateral, we see the ballooning of the distal femur due to metaphyseal widening due to hyperemia. Other common finding is squaring of the distal femoral condyles, not classical in this case though. Okay, so quickly summing up the acute case management, no immediate aspiration at all. Only if massive tense swelling, neurovascular involvement, preferably after factor correction. Factor replacement 8 or 9 as per SA immediately. Rise therapy, posterior knee splint in slight flexion, and only paracetamol, no aspirin or NSAIDs. So chronic cases are usually a picture of synovial hypertrophy and synovitis. So non-operatively we manage with regular prophylactic factor therapy, physiotherapy and bracing. Operative, if there is recurrent bleeds, we go for chemical synovio-orthosis, that is ablation, radioisotope synovectomy and arthroscopic synovectomy. Hope you found it useful. Thank you.